will welcome Dr. Pankaj Bhardwaj. We'll have our comments after this session.
Okay, so thank you so much, sir. Thank you very much, Chairs, for this introduction. So for the next, I think, 30 odd minutes, or 20, 25, 30 odd minutes, what I will do is I'll take you to a kind of experience which AIMS Jodhpur is having and some of the other institutes. But before that, I think it's my duty to express my sincere gratitude to Professor Shaji for inviting us to this place, to Vice Chancellor Sir and his entire team for giving us this opportunity to share these thoughts. Now, after the presentation of Dr. Patel, things are a bit difficult for me, at the same time, a bit easier for me also. Now, what we have heard from Dr. Patel was totally kind of a research at a level which has a global impact. An impact where the policy is being framed and changed. And the topic which is now being entrusted on me to speak for the next 20, 30 minutes would be to engage these young researchers, as we say, as I think in the morning Vice Chancellor was saying, catch them young. So, a bit difficult for me to have a transition from his presentation to where now these young chaps are to be engaged. But at the same time, I thank him for making my task a bit easy also, because when he said that when it is research in medical, nursing, dental, physiotherapy schools, it's not just the laboratories, it's actually that where the community is engaged, where the actual effect of treatment, diagnosis, and management is there. So I bring greetings from these two places. In my introduction, as you all know that I am coming from Jodhpur. It's the central, it's on the western part of the country. And there are two institutes which are being shown, and that I've shown purposely. Because one is my own institution, AIMS Jodhpur, where I'm currently working. But I'll be shifting my base from here to this place, which is again an institute of ICMR, which is National Institute of Implementation Research. And within 6 days, I'll be shifting my base of work from AIMS to this place as a director of this institute to work on the implementation research, where I'll be sharing some of the thoughts with you. But these two things are also important, these two photographs, because today Research Day is actually a kind of a joining between a medical school and what ICMR earlier used to do, a kind of rails. I was discussing with Dr. Patel in the morning, that earlier medical schools and ICMR, they were not joined anywhere. They were actually working parallelly. They were not talking to each other, but now the days are changed. And now ICMR, which is Indian Council of Medical Research, has some say in the medical schools, and medical school professors have some say in the ICMR. But let's start with the first slide. And I'll take you to this slide, that do undergraduate students need to do research? Now, this is the biggest question which we should have before we go to the other slides. And it says, when we say why undergraduate research matters, there are three things I think Dr. Patel also mentions. That there is a need, there is a demand, and there is a supply. We all know that these entire mechanism is built on these three things. Is there a need? And if there is a need, if somebody is demanding about that need, and if there is a demand, what are actually being supply mechanisms? Are there supply goods? So I'll come to the first part first. Is there a need to do or to engage these medical undergraduates in research? Because if you remember, 30 years back when I was a medical graduate, that time, the only purpose of medical schools was to train us in skills where we come out of the medical school as clinicians. We do our practice either in public sector or private sector. That is all what is required from us as medical undergraduates, not as a researcher anymore. And when we used to talk to us professors that I'm interested in research, they used to say, if you want to do research, I think medical school is not the right place for you. You should have joined something else, because medical schools for undergraduates are there to learn clinical skills, to learn how to manage cases, to learn diagnosis, to learn management, and that is all what is being said. But now the scenario is completely changing. And when I say there is a need, yes, there is a need, which is being mandated right from the side of students as well as from the side of the National Medical Commission. We all know, as I'm in a university sitting over here where there are a lot of medical schools, nursing and dental schools, CBME says that now it is the time to have active engagement of students in learning process. They should not be the passive listeners. They should not be the kind of a recipient where they are passively gaining knowledge. They should have some critical thinking and they should have some scientific inquiry. And if you go on that side, it is very well written that yes, we all are knowing about that initially there were only the cognitive domain and the psychomotor domain, which these medical schools used to talk about. But now, gone are the days, now we have been talking about affective domain. And when we say affective domain, it is on the higher rung of learning, if you remember that pyramid. And there they need to understand how to analyze the situation, how to get, open-mindedness, systematic, question-seeking. I still remember when I was a medical graduate, I was not supposed to ask a lot of questions. Our professors, they didn't like, if somebody was asking a lot of questions. He used to say, do it like this or do it like that way. If you have questions, then go to another class. I'm not interested to answer your question. Sometimes they even say, these are untoward questions. I'm not interested to answer your question. But now it's the time when they encourage innovation and problem solving skills. And I think that is the most important part when we say there is a need. And that practice and theory gap which Dr. Patel was saying, I think this is something where we say, yes, there is a need of having research in the undergraduate curriculum. Now, we were talking about yesterday also, we were talking about evidence-based medicine. Again, the paradigm shift, the change is there. Earlier, there was a traditional way of managing a case, but now the cases have already been changed. And now it says it is on evidence-based medicine. And when we say evidence-based medicine, these are the three circles which we talk about. And they talk about that individual clinical experience, that best external evidence, and the patient values, ethics, and expectations, which is the important part. And if you go to that circle where it is best external evidence, there comes the research, where we say that our undergraduate students need to understand how to conduct a meaningful research, how to generate data. And when we say it's a meaningful data, it's a meaningful information. As we say that garbage in, garbage out, then they should know how to do clinical research right from the very beginning and then take it to their postgraduate years and then once they are faculty or consultants in the public or private sectors. The engagement in real world context. I'll share you with this example. When the COVID-19 crisis was going on and we were requesting our medical graduates to come forward for vaccination, they were not. This study which we conducted with the undergraduate students in AIIMS Jodhpur, with the Google, all those sheets, taking the view of medical schools of all the country, that why medical students are not coming up forward for taking COVID-19 vaccine. And there were a lot of questions which these medical graduates were telling, that there are news that it is being done very rapidly, the kind of protocol which is to be maintained is not maintained, it is something fishy, government is putting a lot of pressures on students. So all these inquiries need to be there. And the study was published, and this is from this, if you look at the Jyoti Jain, this is our undergraduate medical student of second, third year, which she collected data and then we found out what are the solutions and what should be done to address the vaccine hesitancy. I think many of us remember this because many of us will agree that it is not a very good program, and I'm not going to go in a debate which National Medical Commission says when it says that family adoption program is an important part, engaging students from the very beginning, from the first years or second years or third years. So we have been invited by National Medical Commission. I was invited by National Medical Commission to analyze the data from all these FAPs. Does it make sense? Because this data is being collected by medical undergraduates. As I said, that here we are engaging medical undergraduates in research. It's not entirely research. It's just a survey. But does that survey matters? Yes, there was. The undergraduates collected data and there were a lot of information which was not sometimes available or which is available in a different way in NFHS. I don't know how many of us who are there from community medicine have compared this data to NFHS data. So NFHS, which is a big survey by Government of India, but this is the data which is being shared by our own medical graduates through family adoption program. So what I mean to say is, yes, as Dr. Patel was saying, that when we engage these medical students with a lot of resistance or maybe some technical things, some challenges, the students got engaged from the very beginning, and now they've started working on this. Now the FAP is moving in few states in a very meaningful way. Now these are two very important facts also, because when I say is there a need, the need should not come only from the service providers, it should also come from the students. Do students need also take it as a need of a research to do or to get engaged in research? Yes. And this is something I was talking yesterday evening also, that when we are framing anything for students, please engage students as an important stakeholders also. So when we were asking about, do undergraduate students need to be engaged in research? Is there a need? Yes, there were answers. You can see it was one of the papers which was published, and those students who wanted to go abroad, those who wanted to have good residency program here in India also, they said yes. In our CV, they say that yes, the person has been engaged. In one of the pediatric residency programs in US and Europe, they say more than 70% are there who have done something during their undergraduate years. Now, the second thing which I have purposely written is on the systematic reviews. You know, the purpose of engaging these medical undergraduates from the very beginning in systematic review is a very important work which earlier was never been motivated by our peers or professors when we were students. So, yes, it's a need. First of all, as I said, that I need to understand first, or we need to understand first, that is there a need right from the side of those who provide this medical education and to those who actually receives this education. Now, as I said, there is a need. So, no doubt about it. Students are saying there is a need. Teachers are saying there is a need. But who's actually, then what is the demand? So, is there a kind of a protocol or something where all these universities are to be engaged in? Yes, National Medical Commission. We all know that after the CDME program, the research atmosphere or ecosystem has to be maintained as a mandated activity from National Medical Commission. And they say that 4-week blocks in MBBS third year, part 1 and part 2 is an important part which they need to understand. Now I'll come to that, how we have been providing it in different schools as an experience sharing. And I was very impressed to see in the morning when Vice Chancellor Sir has felicitated most of the medical schools, and they've got a lot of research output from Kerala. I was talking to my colleague when I was sharing with her that, in North India, we always look to Kerala. When somebody says that, do something good in Rajasthan or Delhi, we say, let us look for some good clinical practices or good practices what Kerala is doing. So applaud to Kerala University of Health Sciences. They have started this research aid, a very good initiative which I'm taking home, and I think in the next experience sharing which I may be doing in Lucknow or maybe in Banaras or other states, I'll be sharing the example of KUHS. Now when I'm saying demand, then again, let us engage students. Do students also demand? As I said, when we were there on the need side, we had a view of both the students as well as the teachers. But when it comes to the demand, mandated activities from the National Medical Commissions, but do students demand also that they need to be engaged in? Then there are very many challenges. And I'm not going to go in a huge challenge list which we got from the students, but one or two we have seen, and they say that because we are not going to be assessed, we all know in medical education, we know that students are 17, 18, 19 years old chap. They don't go to, kind of series where we say that do some impactful research. First of all, they are very much interested to do only that thing which is being assessed in their exams, which they are going to get some marks or credits, which is going to get them into some PG, courses. So that is something, and they say, no, if suppose we do it, it's actually a kind of a waste of time and it's of no worth participating. If we do something else, if we go for an online coaching for PG entrance test, that is going to help us out. And then they say that most of the government, it's a study from South India only, where they say that all years we have never been exposed much meaningfully. And if suppose we have been asked to engage in research activities, They're very small research activities which we do only because of a tip which our professor said as a part of an STS training program of ICMR, but no such meaningful activity, because as Dr. Patel said, if we need a kind of an impact, we need more meaningful engagement of students. And from their side, believe me, most of the students will say that it will only add to an extra burden of their clinical duties, rotation, clerkships, and internship duties, which they are not very much interested in. So with all these challenges of need, demand, and supply, let us see what is there in the current landscape, or what actually are we providing to these young, bright undergraduate students as per the national central facilities in India. So first of all, this short-term studentship program, and as I said that I'm also going to be a part of ICMR in next 6 days as director of one of the ICMR Institute. This is a very limited offer to undergraduate medical students, where we are saying that every district in this country is having a medical school. So there they only provide around 60,000 rupees, where there are some kind of these installments which is being given to them. And these, I don't know if some of you have already participated in this, that these 60,000 rupees are not to be spent on anything. This is just an honorarium for them. If they need a kind of support on logistics, if they need some kind of extra money for lab consumables, it cannot be spent from this. Institution has to give an undertaking that this 60,000 rupees is their pocket money. If suppose they are doing something, they need logistic support, laboratory support, clinical support, that is to be provided by the medical school. Again, a challenge, a big challenge. So if suppose we need to give anything to them, as I said, that it needs kind of that logistics and those funds which is required. I'll share with you one of the institute where I have colleagues and I had an affiliation also is King George's Medical University, Lucknow, where what they've said, I think it's a very small thing, but they've made some elective module on research initiative, and they've started, like this university, we call it as Kerala University of Health Sciences. We have a similar university in UP with the name of Atal Bihari Vajpayee Medical University, Lucknow, where they have started a fund by the name of Atal Innovation Fund, where what they are doing is they are actually having a kind of a corpus fund from where they are actually spending some small amount on these consumables or logistics. Because as I said, that ICMR says that from 60,000, bucket, you are not allowed to spend even a penny. So what we actually need to have all these things together is to have a very robust ecosystem if we want to engage these medical graduates in research. And when I'm saying so is, yesterday or 2 days back, we had a discussion with Director General of ICMR, Dr. Rajiv Behel, when he said that if something works, it only works if each part of the chain is working. And when I say each part of the chain, that means it is whole ecosystem, right from students to the publication. Everything should work, then only it is going to work. And he says that if anything goes wrong, even if single thing in the chain goes wrong, the entire outcome is going to be affected. That means if you want to do something good, everybody has to be good. If something is going to be bad, even a single chain is there, if it is not doing well, that is going to disturb the entire outcome of the project. So what actually do we need? So I have put it purposely because Vice Chancellor is also sitting here, and we all, as a professor, we all, most of the time say institutional support is not there. So what kind of institutional support do we require when we think of some ecosystem of establishing research engagement of undergraduates? Number one, the capacity building. So that is something which is very important. So research methodology workshop or meaningful research methodology. I'll share with you what we do in AIIMS Jodhpur. In AIIMS Jodhpur, the undergraduate students are invited many a times in a year to participate in small workshops, and these are hands-on workshops, like I've written, reference managers. So we take only one day. We teach them, we train them on how to use EndNotes, how to use Zotero. So that is something, and that is not the whole day workshop. That is only for 1 hour or 2 hours which we do, but we invite them. And this is something which is being done looking at the curriculum of MBBS, because we are not supposed to disturb that, or dental colleges or nursing or pharma colleges. So we need to have these kind of, or SRMA, systematic review, meta-analysis. It's a continuous handholding of these students. Believe me, out of, because in AIMS Jodhpur we have only 125 intake of students every year. Everyone is not interested, but those of them who are interested, we take them on board, and there is a continuous handholding. Mentorship program, there these, I'll show you what AIMS Jodhpur is doing. We have a regular program. So suppose some students attached with me in first year, he or she will be attached with me till 5th year. And the outcome of the project will be assessed in the 6th year. So it's not just for the sake of publications. It's a continuous activity which they usually do during their summer breaks or winter breaks, which we give in institution. Student research cell. In institution, because we know that there are MD cases, PhD cases, MCH, DM, MPH, so huge work on the postgraduate. So who cares for these small chaps? We need dedicated cells. We call them as AIMS. We call them as student research ethics subcommittees. So when these, small projects are received from the students, they don't go to the entire whole big channel of ethics, IECs, because it's a huge long channel, and students get demotivated very easily. So we don't want them to get demotivated. There are small subcommittees where again there are professors. They report to the big IEC. But if they have already reviewed it, only IC ticks because student subcommittee has already seen it. Publication support, we also give publication support, and I'll come to that, how do we take that publication support? Because the kitty of money in a medical school is always limited. So one cannot allow the directors of AIMS or VCs of universities to spend endlessly or infinite on the publication. So what are the criteria which we are using? I will share with the group here. Now this is something, and as I said, I'm going to put the photograph. I request Dr. Shaji to share the photograph of today's event. This is one of the events which I participated in, SMIT, Chennai. The institution name is Savitha Institute in Chennai, where I've been invited in the same program as a keynote speaker. And there they have this summit by the name of STAR, STAR. I don't know if you Google it. It's one of the biggest undergraduate and postgraduate research dissemination workshop or dissemination event, which goes for 3 days to 5 days, where they felicitate these students, and there they even handhold these students to the level of ideation, to validation, to scaling up. Even they connect them to some of the funders with which they can scale up the product. I remember one of the dental undergraduate student, along with a postgraduate in dental in the Savitha Dental College, have made some dentures, and that dentures prototype was then patented by the Savitha Institute only, and then scaled up by connecting them with some of the company people. So that is being done by those people. So what actually we need to do is that we need to have some procedures or protocols which are made available to all, each and every student. So when we induct these students, like we do in AIMS, that once the students are inducted, right from the first day they've been told that there are 3 pillars or 4 pillars on which AIMS stands. And we say first is academics, which is a quality medical education, which changes you to a good clinician or public health person or surgeon. The second one is, which is very important, is research. And we say boldly that research is something where you will be engaged in and you should be engaged in from the very beginning. The third one is public health. We say it is something which is very important, and fourth is the patient care. So all these 4 pillars are to be made very clear to the students from the very beginning. Leveraging technology, websites, LinkedIn. I think we need to understand. Sometimes I was also discussing it with the team yesterday when we were having dinner together, that we need to understand the way we should interact with students should be totally different. Don't give us our own examples. We are 30 years old, medical graduate. Now the science is evolving. So they should take leverage of technology, whether it is LinkedIn or whether it is through how they can be connected with the people who are actually being engaged in the same research that should be done. Now, this is an example of what our institution is doing. You can get it from our website. So we have maintained it. This is the name of a program that AIMS is doing by the name of SIRI. We call it as SIRI, SIRI. You can see that Student Innovation Research Initiative, SIRI. So what we generally do is every time when ICMR invites STS applications, hundreds of students apply for that. But only 5 or 10 applications could go through ICMR because ICMR has to fund all the institutions. So what we do in AIMS, these 90 applications who are rejected by ICMR will be considered by ICMR. So those 10 who are already, because these students have also put their lot of efforts, brains, and their faculties are also have put a lot of time in that. So we respect that. We ask them to put that project proposal in CD initiative. So what we do is that it is known as summer research studentship, and there the students can work on that. But again, this again will go to the scientific board of student research as well as ethics. So we are not saying that these 90 projects who are rejected, which are rejected by ICMR, are not having a kind of a fear of not being rejected by INS. INS can also reject them. They may be not of that order that one should work on. But yes, we give them fair chance. But that let us give a second chance to these students and we again assess them. If we find them good, they work with us for on that project. You can ask us, do they get that 60,000 bucks which ICMR was giving? No. They don't get 60,000 bucks from our side. But whatever support is needed, as I said, logistics supports, lab supports, the Dean of Academics, it is written here, Dean of Academics and Dean of Research. We have 3 deans in our medical school in AIMS. Dean Academics, Dean Research, and Dean Student Welfare. Then these 2 deans, they sign this, that whatever support is needed as they have qualified CD, so that will be provided. We do second also, the first was summer research scholarship. The second one which AIMS provided, summer research observership in other institutions. We send them to different institutions. I'll share with you what exactly we do. Like for example, one of our students was very bright and he was very much interested to understand how the AI chatbots work for patient care. Some remote sensing mechanism. He was working in his short, posting in anesthesia department, and he was informed by the anesthesiologist that the remote patient sensing is or remote patient monitoring is very important, and because in those areas where anesthesiologists are not there, critical care people are not there, once the person is discharged, we need to understand how he or she is actually improving upon or not. So then we sent him to IIT, IIT Mumbai. We sent them to IIT, even Jodhpur. So wherever they make connection, either with the connection of faculty or they can write to these mentors, and we send them. But you can ask us that how do you manage? Because there is a system in MCI or NMC. They need to, clear all those hours of teaching in the curriculum. It is only allowed during their summer vacations. It is only allowed during their winter vacation. So when there are vacation time, we allow them to go over there. And we also extend some support. You can see on the 5th point, if suppose it's a good program and the institute considers it to be a good program for that learning, we even extend the traveling support to these students to a level of 2nd sleeper ACTK. Now this is the third and a very important program, and I'll share with you the experience which we are having currently with us. This is known as Joint Group Student Research Initiatives. As Dr. Patel is sitting with us in Harvard and John Hopkins, they have a concept again, I don't know whether currently they are having or not, we call them as capstone projects. So when single student is not ready or not interested to take all the work, we invite them in groups. If suppose there are 5 or 7 odd students, we ask them to come in groups and bring their ideas, and we will mentor that. Because if you remember, STS says one student, one guide. It is very difficult because everyone is not interested, neither students nor guides. So what we generally do is we ask them to come in groups. So this is a joint group student research initiative where 3 or 4 students can come to us. Even they can ask 3 or 4 of us and the faculty also, that is also allowed. The research the research protocol is again vet by the Dean Academics as well as Dean Research. The only change in research in undergraduate is whatever application is received, it is to be jointly reviewed by Dean Academics and Dean Research. But for faculty or postgraduates, only Dean Research is the authority. But for students, because it has something to do with their education also, so joint signatures of Dean Academics and Dean Research is also needed. Now, this is one project which goes till 5 years or 3 years, whatever is the duration. And in each summer vacations, like for example, that student, if she's in the first year or the second year or third year, she can come to me with the project progression in all the summer vacations. When she was in her first year, second year, third year, and I need to mentor it. And guide has to give this undertaking that they cannot leave these students in between. Otherwise, they have to get a kind of a letter of warning from the dean research or dean academics. Even they can issue that letter to the faculty. Okay, so now I was coming to this. As the amount of money is always finite, and people ask us, AIMS has got a lot of funding. You have no issues, but other universities do have because they have to look after so many medical schools. What should they do? Look for the opportunities. We need to find these opportunities. I remember Med Engage program when I was approached, when I was the Dean of Research at AIMS Jodhpur. Metropolis Education, they actually contacted me and said that your students would like to participate in this program. And I was surprised that these kind of programs are actually existing. There are two such programs, and I'm just, because this is a conflict of interest and I belong to a central institute, I should not advertise these private agencies or pharmacy company. But yes, they are there. And they actually are providing sizable or kind of a seed money to these students to do research, and a good program for 2 or 3 years. Now, some of the studies, as I said, I'll be going towards the last part and some of the sharing of experiences, what are the outputs or impact. The impact may not be that meaningful, which Dr. Patel was saying, but definitely, as we say that these medical graduates, when they are starting their research endeavors, they make some changes. This is the study of Manipal Medical School, KMC Manipal, where they are actually showing this 20 years of mentoring undergraduate students. There, that Savita, which I've already talked about. This is something which my colleagues in Ahmedabad, they did, and that was something when they used this mobile technology, and they use these students. Believe me, as I was saying, that we professors need to understand that some of the students are good in some of the technology which we even sometimes cannot imagine. So they have used this AI for disease surveillance, and this program is running very nicely in Ahmedabad. This extreme heat and urban mortality solar project is again being undertaken by the undergraduate students and being funded by IHMR University. Now I'll go to the last part and I'll quickly share with you one of the experiences which I said I'll be sharing at the end, that when we engage these undergraduate students, and they helped us out. This was in a final year students. They were 3 or 5 final year students. And then till internship, they help us out in getting this. So this was a capstone project. And this capstone project was on this. Dr. Patel was telling us about, yes, we are going to be the 12% population of this country in the next 5-10 years will be elderly. And when I say of 1.4 billion people, of 10% of 1.4 billion people, it's a huge number. So we've been invited by WHO to have a kind of a piloting of ICOPE. ICOPE model is integrated care of older people in this country. And we were asked whether this screening tool which WHO proposes can be used in this country. So we were given a very limited time to do this. So we thought of engaging medical students. So final year students who were already trained in all the departments, medical, surgery, gynecology, not pediatrics, but orthopedics, ophthalmology. So we invited them and we asked them, any one of them is interested to participate? They said yes. These were the 5 steps which they need to be doing in their community during their time when they can spend time. They need to screen these people, they need to go to the community and to assess the intrinsic capacity of these elderly. They need to help interns as well as the postgraduates of community medicine to prepare that person-centered assessment plans, and referral pathways, which Dr. Patel was saying, was also to be taught to them. But I'll tell you how interesting the entire journey of this capstone project was. Now this is that ICOPE intrinsic capacity assessment tool, which was provided to us by the WHO. And they say that we need to assess these elderly on these 5 or 6 areas, which is cognitive decline, limited mobility, malnourishment, visual impairment, hearing loss, and depressive symptoms. And we asked them, can they ask this small question in the community, that can they remember 3 words? So WHO was saying, ask some flour, dough, and rice. So when our students were engaged, so students said sir, this kind of study cannot be done in our place in Jodhpur, or that too in the tribal areas of Jodhpur, because we need to, customize these words for our own community. And we asked WHO, can we do it? They said, yes, this is for what we are actually approached, aims to do it. And the engagement of these students and interns help us in getting to these words. I'll show you later on. These are the screening tools. These are just 2 examples. It's a big study. These kind of chair rise tests, again, when students do themselves, they understand how much it is meaningful. And they feel so happy at the end when I show you the results, that they were able to screen intrinsic capacity deficits in these elderly people in Rajasthan. This was the step 2. After screen positive, these are to be connected to the PHC or the CHC, where our postgraduates of community and family medicine sits, and there they make their personalized plan. So this is that step 1, just an example, and then I'll take you to this study which we did in Jodhpur with these students and interns. That first of all, if there is for example, limited mobility by that chair test, if that is positive, we go for SPBB and then we do an intervention. This is just an example. And this is that short physical battery test. So all of us who work in community health or who work in screening of these elderly know that this is a very important tool by which even we can tell if an elderly has a tendency to fall. Something which is so important for us to understand, that when these elderly comes to our clinic with their son or daughter-in-law, then their son and daughter-in-law complains that my mother or my father do not care. I don't know, even they think themselves that they are so young that they walk so swiftly and then they fall down. It is so distressing to hear that they are saying these kind of words for their father and mother, and they are not understanding that this elderly person is having a tendency of fall. But when we do it systematically in front of the caregiver, he or she understands that his mother or father is having a tendency to fall. So this was something which we did with the medical graduate, and this is not developed by us. This is a WHO project. So we developed all those care pathway. Now I've come rapidly to our study. So we were actually these 4 countries who were engaged in this. This was Andorra, Beijing, Occitania, and Rajasthan in India. And we tried to engage these medical graduate and interns. So try to understand, and I have purpose, this is there in the WHO website, you can see it. And you can see on the right, the students were very amazed and they were very, excited to share this finding with us when they did it. Because in most of the places, cognitive decline was the most important intrinsic capacity deficit which was seen. But in Rajasthan, it was not so. It was actually hearing loss. So when they themselves found it, they were so excited. And they said, sir, once we receive these, elderly, though we look for all the effects, though we look for cognitive decline, loss of mobility, visual impairment, hearing loss, malnourishment, depressive symptoms, but we will look for a kind of a hearing loss, which is an important issue in Rajasthan. Now we need to understand why it was so. It may be a methodological issue, it may be, but we found it. Yes, it was a case. And this is how the practice changes. That once they are doing a comprehensive geriatric health assessment, they were actually putting a lot of pressure on the hearing, this assessment. And they started looking for a hearing losses in these elderly, beside going for other domains. So this was something which we did. So these were a few villages which were adopted under School of Public Health as well as Community Medicine. Now this was something which was again shared by these students. Even you can look at the cognitive decline. The words which these students brought for us was, you can see there it is written, 3 words were not what WHO says. They says it was heart, Vatki and Mungada. And this was what we proposed to WHO. WHO says, yes, when you have evidence, we will take these 3 words for the manual if it is being developed for Rajasthan. Chair rise test. Our students told us, there are no chairs in these, rural areas, sir. What can we do? They again sit with our orthopedician friends and then they said it is 17 inches, kind of a platform. Again, an innovative work. We engaged them meaningfully and they were bringing us so much of solutions. And believe us, when we faculty are working with our residents, we have got difficult work and multiple works to do. But when we give something to these undergraduate fellows, we give them their due weightage. They are they are actually bringing us marvelous things and theories which we say. This was actually the kind of an intrinsic capacity assessment which we did with them and in interns. Yeah, and thanks to intern team also. So that was also a part. We did this second phase again with the interns, not with the medical graduates, because the personalized care plan need to be maintained. And we tried to find out, are we able to connect these elderlies to the hospital? And to your surprise, you can see that, first of all, that the assessment was okay. You can see on this step 2, this was done by the doctors in PHC. And this is done by medical students. On the step 1, this is by medical students. On step 2, this was by the actual medical officers. So you can see there is a difference of numbers, there is a difference of percentage also, but not that much. Actually, they were able to screen them in a perfect way. Now this is that personalized care plan which we made when we sit together with these young minds, these interns, as well as these medical officers. And now we are giving this book to all elderlies. Then we are screening them. Now it's a regular program in community and family medicine at AIIMS Jodhpur. So though it started as a project, but now we have imbibed it, we have engaged it, and it's a regular program where we are actually adopting villages and screening these elderlies and bringing them and connecting them for the continuum of care. This is how we are doing it. So my last slide. So learnings from this capstone project for us in AIIMS Jodhpur was building all those ecosystems, as I said, and thanks to Dr. Patel again, that actually these are the laboratories where we need to engage our students. They don't need much money. That funding would not be an issue again for the directors or vice chancellors. But yes, students learned the integrated and holistic way through these kind of projects, problem solving in real world situation. They were engaged from the very beginning in getting a kind of a personalized care plan with screening at community level and proactive engagement. So that was something which was a kind of a lesson which we could take from the capstone project, which started as a research project, but now it is a kind of a good clinical practice in our department. So my last slide, so call to action again, that thought which we say that future in health science depends not just on education, but on empowering these undergraduate students to discover, question, and innovate. So I think it's the time when, as I said, the days have changed. We need to build this ecosystem to nurture this curiosity and drive that. Thank you so much.